Hello friends, in today's video we are going to discuss about how to manage a case of pneumonia. Treatment of pneumonia is different for the OPD patients and indoor patient. In indoor patient is also different for the non-ICU ward patient and ICU patients. To decide whether the patient require the OPD treatment or patient require admission in ward or patient require admission in ICU, it is based on the curb 65 criteria. We will discuss about the curb 65 criteria in the last slide of this video. Now, how to manage a OPD patients of the pneumonia means the stable patient. In the stable OPD patients, if the patient is the healthy and patient had not taken any antibiotics in last 3 months, then the treatment is macrolides, which includes azithromycin and the clarithromycin. Azithromycin dose is 500 mg on the first day, followed by 250 mg once in a day for second day to fifth day. The dose of clarithromycin is 500 mg BD. Alternatively, we can give doxycycline instead of macrolide. The dose of doxycycline is 100 mg BD for 5 days. But if the patient is having other comorbidity along with the pneumonia, like patient is non-case of diabetes, hypertension, non-case of chronic kidney disease or some heart disease, or patient had taken any antibiotic in last 3 months due to any other illness, then we have to go for respiratory fluoroquinolones or beta-lactam group. In the respiratory fluoroquinolones antibiotic included is moxifloxacin and the levofloxacin. The dose of moxifloxacin is 400 mg oral once in a day, or levofloxacin 750 mg oral once in a day for 5 days. We can give beta-lactam group, which include augmentin, which means amoxicillin plus clavulanic acid. The dose is 2 gram BD, or we can give cefuroxime 500 mg BD or cefopodoxime 200 mg BD. Along with the beta-lactam, we have to give macrolide, means the azithromycin and clarithromycin along with the beta-lactam group. The treatment for the indoor patient which are admitted in the wards, non-ICU patients, are treated with the respiratory fluoroquinolones like moxifloxacin 400 mg oral or IV once in a day, or levofloxacin 750 mg oral or IV once in a day for 5 days. Or we can give beta-lactam group like ceftriaxone 1 gram BD or augmentin 2 gram BD or cefuroxime 500 mg BD or cefopodoxime 500 mg BD plus macrolide, azithromycin or clarithromycin. If the patient is admitted in the ICU, then we have to give the ceftriaxone 1 gram BD or the cefotaxime 1 gram TDS or cefoperazone sulbactam 3 gram BD along with macrolide or respiratory fluoroquinolones. Macrolide is azithromycin or clarithromycin, or respiratory fluoroquinolones is moxifloxacin or levofloxacin. Now some special conditions in pneumonia. If we are suspecting the pseudomonas infection or we identified pseudomonas in sputum culture report, then we have to give anti-pseudomonal drug which included piptaz, cefepime, imipenem or meropenem. Piptaz means piperacillin plus tazobactam. The dose is 4.45 gram per 6 hourly. The cefepime is 1 gram BD. Imipenem is 500 mg 6 hourly. Meropenem is 1 gram TDS. Along with this, we have to give the respiratory fluoroquinolones, which is moxifloxacin or levofloxacin. If we identified CA-MRSA, CA-MRSA means community acquired methicillin resistant staph aureus in the sputum report, sputum culture report, then we have to give vancomycin or linezolid. The dose of vancomycin is 15 mg per kg per day, and the dose of linezolid is 600 mg BD. Along with this, we have to give clindamycin 300 mg 6 hourly. Now, how to decide whether to keep patient in the ward or ICU, or we have to give treat patient on the basis of OPD treatment. It required the criteria known as CURB 65 criteria, curve 65 criteria. C means confusion. If patient presented with the confused state or altered mental status, patient's urea more than 7 millimole per liter, if patient's respiratory rate is more than 30, or if BP is less than 90/60, or if patient's age is more than 65. Each variable has 1 point, means CURB 65 total is 5 points. If there is no criteria is matched, then the point 0 means the patient is stable and we can treat on the basis of OPD. If one or two variable is positive, then we have to treat in the ward, but we have to admit the patient. Or if three or more variable is present, then we have to treat patient in the ICU. Thank you so much.